Sounds good. Well, thanks everybody for showing up. Bob Leakey, Executive Director of PAMA. And as Kathy was saying, we do record this, and we'll post a link onto our homepage just in case you want to catch it again, reruns, or spread the word to other folks. We'll put the link on our homepage here shortly once we're done, after we're done. Anyway, welcome. Just a couple sort of quick news updates, and then we'll turn it over to our speaker, Melissa Dern. And so, good to see you, Melissa. First of all, just for anybody who maybe hasn't heard, the city and county have these COVID recovery funds. And there was an application period initially that we were told it would end on like July 17th, but it's actually being extended through the bulk of August. And the access, this is good news. This is very good news. It means the money's not gone yet. And so I really encourage folks to take a look at it. And if you thought about applying but didn't in the first round and you'd like to now, you can do that. We have the link on our PAMA, parsonsarea.com, on our PAMA homepage. It's the very top link that says click or press here for COVID small business recovery funds. And if you scroll down, if you scroll down, can we make sure everybody who's not talking mute stuff? Thank you.
I just muted everybody, Bob, but you and Melissa.
Thank you. If you scroll down that page, you'll see a how to apply, section. And all you need to do really to get this started is it says to be notified when phase 2 opens, click here. And just click here, and it just you can put in your information, your business information, and that's it to get started. So anyway, that's coming. Also, just updating folks, PAMA is partnering with the Southern Ohio Chamber Alliance, really cool organization here that what it amounts to is that anybody who's a PAMA member is eligible for any of the different services that the Chamber Alliance procures with different vendors. And we're rolling out presentations about these. And I have a couple more things to say, Melissa, then we'll turn that over. But Melissa is here with the company Strategic HR. Really cool stuff around HR stuff for small businesses. So we'll give a presentation on that. But there's also, the link on that basic information on our homepage. And then next month, we're going to have folks here from essentially utilities and energy kind of discounts, and they'll be giving a presentation on our September 2nd call. So we have that coming up. Then I wanted to also give you a heads up, and I'll be sending out to the folks on this list the flyer about it earlier today. But coming up on Wednesday, August 19th at 4:30, there's going to be a discussion session hosted by Southside Thrive, Community Development for All People, Celebrate One, Ohio State, different folks, about with CODA, and talking about the different transit service changes that are going on, and some new initiatives that are coming, and it's to collect your ideas and input. And they really encourage folks, come to this if you can. I do have the flyer, a connection to the flyer on our PAMA, Parsons Area Merchants, or PAMAarea.com website. Can't talk this morning, sorry. It says CODA and transit service changes. So yeah, that link will take you to this flyer, and it's a WebEx. So, do encourage you to attend that if you can. One of the sponsoring organizations is Southside Thrive, a really cool organization here in South Columbus. And Sarah Lenke, I don't know if Sarah's on yet or not, but she is going to be doing some presenting here for us about some work that Southside Thrive has been doing, surveying and evaluating the impact that COVID has been having on South Columbus. So that's coming up here a little bit later here, hopefully. So with all that being said, that's the basic news that I have. And with that, how about if I turn it over to Melissa Dern? And Melissa, the floor is yours.
All right, awesome. Well, thank you, everyone. I'm really excited to be here. We became a SOCA member, gosh, it's been over a year, really rolling out to all the chambers and getting in front of the members. So I'm hoping you're finding what we have to offer to be useful, maybe not today, but as you have needs coming up, and we've definitely been a great partner with companies through COVID, really did a lot of consulting and answering questions. So I'm gonna try to share my screen here and see if this works. Can you guys see my slides?
Yep.
All right, love it when it works. So we're Strategic HR. I usually do it, I'm at home this morning, but usually I'm in the conference room and I have the big wheel behind me. But if you see on the wheel, everything on there, we kind of do. We do recruitment, training, benefits, communications, employee relations, health, safety, and security. So if you think about any type of HR, we can do that in any size, small, big, large, and I'm going to kind of break all that down for you. So who we are is we're an outsourced HR management firm. We really partner with those small to mid-sized companies. We've done large companies, we've done startups, but a lot of times companies are very small. They're less than 5 employees, and that's really where we come in because they don't have the budget or the funds to really add that HR help. But you know what? We all have people that we're working with, so we're going to have those HR issues where we have to pay people. There's benefits, and now definitely with COVID, there's a lot of resources out there, but we can kind of help break that down and help, partner with you to get those questions answered. So I want to break down, what our main areas are. I'm just going to put all these up here. Our outsourced HR solution, this is where we can kind of come in and we tailor that HR support to your specific needs. So it could be, you don't have a handbook or you need your handbook updated. We can do that for you. Maybe you're growing and you're adding headcount to your organization, or you're branching out in other areas. We can come in and help build that staff for you. We can help provide that HR support and that direction. We're not attorneys. We're not going to say that we are. So anything that we do that may have some type of legal compliance around that, we're definitely going to have you, refer that back to your attorney to review if it's a handbook or even an investigation in terms of, we'll make the recommendations on the HR side. But if it's something that's going to have some type of legal impact to your organization, obviously we want you to partner with your attorney. We do outsource recruiting. So if you kind of look at the wheel that I showed before, half of our division is our HR consultants. We have Dayton, which goes, Dayton and North. We've got 2 consultants based up there. We have Cincinnati, Northern Kentucky, and then we just opened up in Louisville. So we're starting to branch out. But that doesn't mean we can't, manage anything from coast to coast in the United States. So a lot of times we do our work virtually. If we need to be on site or be in person with that client, definitely we can do that. We do recruiting. We have a recruiting team that handles full cycle recruiting. We really act as that extension of your staff. So it's as if we talk to you, you can ask us questions, we give you updates, and we can really do anything from the start of building that job description, posting that job, screening those candidates, kind of taking all that busy work off of your plate. And then you can actually, do what you need to do to get your work done to support your business. And then we can help you with that recruiting. I oversee our interim HR solutions. So we're not a staffing company. So if you call us and say, hey, I need 10 laborers tomorrow, that's not us. But for the interim HR, because we're an HR company, I talk to, probably 20 to 30 HR consultants or professionals a week and really vet them out to see what type of work they want to do. So it could be permanent, or they may just want to do contract work and just do projects. So I'll vet them out, and then if you call and have a need, or we do a lot of recruiting in those areas. I've done some in Columbus, quite successful. You know, we have a lot of resources, so we can get the help for you that you need, or it could be one of our internal HR consultants that could help. And really where I want to focus is our virtual HR solutions. This is what we offer to our chamber, to the chamber members. We provide all the other and offer all of that. But where the discounts come in, where it's a little bit of a cost savings, it's a little bit probably more, maybe more suitable, you know, if you're on your day-to-day and just having that resource for your HR solutions. It's an online tool, and I think Curtis has been taking advantage of it and taking a look at, you know, just what it is and what it can do. But it provides solutions for training. If you're just needing questions answered, it has forms, guides, checklists. There's a policy library. So if you're trying to develop a policy, you know, if you're not sure how to write it, you're not an HR person, that's fine. There's policies in there that you can use to add to your handbook or to use in your organization. And then there's also a job description library, which we all know, which we all probably all don't have sometimes, are those job descriptions for each of the positions. So it gives you those templates to start with. Some of these I kind of talked ahead here. So here are the HR solutions. Again, this is just if you're looking at it, we're going to provide that head count, answer those questions, and do some key projects for you. And then our recruiting. But I wanted to jump ahead here real quick. Sorry, I was kind of talking and not advancing my slides. So the VHR is what we offer as our chamber member benefit. With that, you get, there's a support center that you can also, it's a year subscription that you can buy into. The cost is pretty reasonable, so it's on an annual basis. So you can get either a library to just kind of do it as you need it. It's a 24/7 access, or you can subscribe to our on-demand, which you can ask them questions. Maybe you need things started from scratch, and they can do that for you. Also, we offer, if anyone's interested, I'll have my contact information here at the end. We do a monthly webinar series, so it's free. It's on HR topics. We have one coming up next week. We're partnering with Graded Law. We did a series of webinars through COVID. He's kind of been our go-to resource on getting us all through COVID and when it all started. I think in the first webinar we did, it changed from the first 5 minutes he started talking. It was an hour long. And then by the time we were 45 minutes into it, it had totally changed. All the mandates had changed. So he's really been great to be on top of keeping us all kind of in that right lane going forward. So this Tuesday, I can send you the link if you're interested, or it's on our website. You can register, but it's going to be talking about that back to school, where we're at, kind of what things are going to look like for fall. There's a lot of things up in the air with schools going back to school and just kind of how businesses are operating. I think in the HR team that's been in the office, I've heard calls every day. Oh my gosh, I have this person testing positive. What do I do? And so we're able to talk through those situations. So you can ask your questions, I hate to say it, but free advice from an attorney for an hour. You know, he'll answer the questions, but a lot of times he has to do some research and find out because it's just changing and he wants to make sure he gives you the correct information. So please join us next week. It's on Tuesday, and I'll send out, if I can, I'll get that information. I can send that out in a follow-up so you guys can register for that.
That's great.
So I guess you're looking at, why should we use strategic HR? There's a lot of companies out there. You may have resources. You may have someone on your staff that does HR. Maybe they're not an HR professional. You're going to have that access to that customized HR support. We've been in business 26 years. We just had our anniversary May 1st. Didn't get to do our big celebration with COVID, but you know, we've got a lot of knowledge. And if you add up all the years of experience, mine alone is about 20 plus years. You're going to have over hundreds of years of experience. No day is the same. Everybody's day is different. Everybody's situation is different. We have our HR team is always constantly collaborating, you know, asking, you know, who has had this situation. So we've really got a big support and able to answer those questions and have a lot of resources for you. you're able to accomplish that without adding headcount. And that's important because I think small businesses, they just don't have the time, the budget to be able to add that headcount. And you don't need it every day, but you need it when you need it. So we're here to help. Sometimes we'll have people that just, you know, reach out to us for maybe 10 hours a month, and they know that they can call and ask questions. We have one of our longer term HR consultants. She's our director. You know, she's probably got 50 clients. She doesn't talk to them every day, but maybe, you know, once every 3 or 4 months, they have a question. They know who they can reach out to, and they're not Googling to find out those answers. We can save you time and money because, you know, if you're using, you know, having to handle with that investigation, or you have a discrimination situation on hand, we can go in and help you work through that versus you taking time away from, you know, working on your business. And then really we can do any HR project, big or small. So it could be an audit, it could be an I-9, paperwork, onboarding, whatever that is, we can help with. So one of the options, I'm not going to take the time today, but I like to customize the demo, is really show you what the VHR is. We're offering a 30-day free trial for anyone starting, you know, it'll go, if you start today, if we set up a time, or this week, it'll go for 30 days. And then if you're interested, just to give you an idea, normally it retails around $600, and we do offer through SACA and then through all of the chambers that are SACA members. It's $3.99 per license per year. So it's a really great tool. When you break it down, it comes out to be like $1 a day. So it's really not expensive, but it's a great tool to keep you compliant and make sure you've got that resource for those schools. It also has the on-demand where you can ask questions. And then we also have an e-learning library that has over thousands, I think 10,000 training topics. Some are diversity and inclusion. There's some soft skills, leadership, management. There are some industry specific training in there. So sometimes, you know, you want that development, the professional development. You go out and it's going to be $1,000 for the training. We offer that. Normally we offer our clients at $250. We do discount that a little bit for our SACA members, and then for you, for the chamber members. So it's $225 per year. So again, it's less than $1 a day for that additional training that you may be paying in one swoop, $1,000 for, you know, a 4-hour session. You have that all day, all week, all year. So I'll pop up here my contact information. If you guys have any questions at all, you can reach me at the office number at the 697-9855. I am in Cincinnati, so it's 513, or always email me at the chambersales@strategicHRinc.com. And I think Bob has that up on the website as well. I know I went through that pretty quick, but any questions that you guys have, who we are, what we can do? And just email me if you're interested in getting that free demo. It takes about 10 or 15 minutes. And we can set you up with the free trial just to see if it might be something you're interested in and taking advantage of.
And I would say anybody who, if you misplace Melissa's contact information or anything, if you just want to reach out to me, I'll happy to connect you as well.
Perfect.
I don't know, does anybody have any questions or things they want to ask Melissa? Don't be shy.
Yeah. Hey, it's Paul here from Wild Seltzer. I do have a question for you.
Yeah.
So I'll like just throw out a scenario that we've dealt with in the past, and you can tell me whether this would fit under your category. So tax season is approaching. It is January. I don't have an accountant. I'm probably going to need to get an accountant because I can't do the taxes by myself this year.
Yeah.
How can I use your services?
Yes, that would fall under our outsourced recruitment. So the nice thing with that is we would talk to you about what your needs are to make sure what our services that we offer is gonna be feasible for you. We do all direct placement. We can, like I said before, we're not a staffing, so I couldn't bring someone in on a temporary basis. But if you're wanting to hire someone and have them on staff, maybe full-time during tax season, and then they flex down to part-time, we just have to know what those qualifications are. So we'll do an intake call just to get the details. write the job description if we need to do that, put the job ad together, screen the candidates, and then filter those through you to set up the interviews. We can do the offer letters, we can do the background checks. So we would just need to have that conversation. But yeah, definitely we can hire those. We've done those in the past. We've got expert recruiters that, you know, focus on finance and HR and healthcare and IT. So we would get it to the recruiter that, you know, can work with you pretty quickly, and you'll have that one point of contact. So yeah, definitely that would be an area that we could help you with.
Great, thank you.
Mm-hmm.
Melissa, just to clarify, that could be a contractor, not not an actual hire. Is that true?
We do the contractors for the HR roles. We have done the others, but that's why I was saying with staffing, like staffing agencies, you know, you call the Manpower or Kelly Services or Spherion offices and say, hey, I need this. That's what they do best. What we do best is more in that HR side of things. So we do have HR contractors. For that position, it would be a permanent position that we could staff for, and we also have partners with other with other staffing companies if that makes more sense if you only want it on a temporary basis. There's no placement fees. We do all the work by the hour, so we let you know what that rate is up front, and that's also on the HR side. So you're not getting hit with that big, large placement fee. You know, it just depends on what we have in our database. We've got probably 10,000 or more, probably more than that. We just converted, we decided through COVID, let's go ahead and just add a new ATS system and convert over. So I'm not sure what the final count is that we brought over of current candidates, but we've got a ton in our database and searches, and we've got such an expert team that we can, you know, usually find that talent pretty quickly. So it would be a permanent role for that. If you want HR and you just need someone temporarily, let's say you furloughed employees and you've got a project where you've got to bring everybody back, we could come in and help you with all of that rehiring and onboarding, and that would just be a project.
Okay, so Paul, just to add, we have had various tax accountants as members. I don't think currently we do.
Mm-hmm.
So certainly business referrals is something else that PAMA could generally help with if you're not looking for, you know, an actual hire.
Okay, great. Thank you, Kathy.
Cool. And any other questions, anybody?
That was a good one.
So just so everybody knows, we've actually signed up for the demo. I haven't had a lot of time to deal with it, but I think, you know, one of the biggest things with COVID and just in general, you know, putting together a handbook over the years, you know, when I had the old company, we would spend anywhere from $2,000 to $3,000 to $5,000. So what they charge is very reasonable. And then to also have that portal to be able to go in, you know, for other resources and everything, it's probably a very wise business decision, you know, just for the employee side of it. So that's my take.
Thank you. And I think too with that, the parts that I like are the templates that are in there. It also has guides. There's like little guides in there, like little mini handbooks on how to do a termination or how to, you know, have that tough conversation. There's different things, how to run a benefit campaign. So it gives you those step-by-step, so you don't have to have that HR background. It's going to provide some of that knowledge. It's going to take a little bit, just a little bit of time reading through that to get up to speed. But there's checklists, and then if, you know, just letters and templates that are all kind of going to get you in that right path. You know, sometimes if you write something from scratch and you're not experienced, you're setting yourself up for some legal issues. Even with workers' comp and dealing with that, we can handle those things because a lot of times you're just doing what you're doing. You're kind of putting a blindfold on and just hoping that you land on your feet. So, you know, reach out to us and see. There may be areas that we can talk you through and get that question answered. And, you know, you don't need us today, but, you know, gosh, you know, 3 months from now, you really appreciated the help we provided and consulting and like, we're not going to take advantage. We're going to help talk you through. A lot of times with those, I'll get you connected with our president, and she's very hands-on in having those conversations to see, what you really do need our services. It's a little bit more than just answering that one question. But, call us, we'll get you connected. It may just be a matter of one question and you're done. And then, 3 months from now, you're like, hey, I really need more help now. So then we can engage in the services. But as Curtis said, that the Virtual HR Support Center is going to give you some of those questions. You're going to have your questions and get those answers.
Cool. Thank you, Melissa. Any other questions? And Melissa, just to let you know, you are welcome to stay if you like, or if you need to drop off, I mean, that's fine too. We try to be friendly, and as you probably heard, we're trying to be done by 10 as well. So,
well, I appreciate it. I do have another meeting I need to run to, but thank you, everyone. If you need to get a hold of me and you didn't catch the email, just reach out to Bob. He'll connect you with me. But again, thank you, everyone, for your time this morning. I really appreciate it.
Yeah, thank you, Melissa.
All right. Have a good day.
Too. And for any folks, I know we had a number of folks who joined us after we got started. We will be posting the link we are recording this, so watch your profanity, but we will be posting a link on our website to the YouTube video on this. So if you want to see all of our talking heads in person and stuff, later on video, you can do that. That being said, this is a busy morning because we actually have 2 presentations, and I see Sarah Lenke here. Hey, Sarah. And Sarah is in charge of a really cool entity called Southside Thrive, and Southside Thrive has been doing, just a lot of work with the community members and local businesses, and we partner on some stuff related to businesses and their COVID experiences and such. And recently, they've done an analysis of the impact of COVID on South Columbus. And Sarah's been giving some presentations about that, and we thought that would be a useful thing, for you guys. So with that, I'm going to turn it over to Sarah.
Great. Thank you, Bob. Hi, everyone. Glad to be here this morning. I apologize for running behind. I'm actually going to try to share my screen. Bob, is that okay?
It should be. Kathy can.
As long as no one else is sharing.
Okay. Probably looks just like a blue background for a moment.
And it's a lovely shade of blue, too.
Okay. Can you see the main slide now?
Yes.
Okay. Great. I know last week I had some trouble, so I do not want to repeat this again. And thank you for those who have kind of heard me talk about this already. But my name is Sarah Lenke. I'm the program director for Southside Thrive Collaborative. And I'm happy that Bob asked me to come and provide some information that we gathered, trying to understand how COVID-19 is impacting Southside residents, and specifically looking at how it's impacting residents, housing stability, economic security, and health. And so my goal with providing some of this data and information is to equip you all with more context and information. And ultimately, Southside Thrive and our network of partners want to be able to continue to mobilize on how we can best support Southside residents in overcoming what are some pretty significant challenges that COVID has created. Okay, because Southside Thrive Collaborative is fairly new, I just want to take a second and highlight our mission and who we are. Our mission is to support Southside residents in living healthy, fulfilling lives by strengthening the collective efforts of community partners. And so we really exist because a complex issue like poverty can't be solved by one organization alone, and because people living in poverty often have multiple needs that are better off to be holistically addressed. So we're really a place-based collective impact initiative, bringing together about 40 plus community organizations, businesses, and civic groups in order to promote more communication, collaboration, and service coordination. And really what all of that kind of means is we're trying to braid together the various programs and services and initiatives within the South Side to be more holistically supportive of low and moderate income residents here in the South Side of Columbus. So our areas of focus are economic mobility, housing stability, and health. And so that's kind of what our presentation today focuses on. And I will share a link in the chat, and it's also on our social media. We don't have a website right now, but we were glad to be able to put together this report with Measurement Resources Company, who really provided some of the data analytics for us. And we also just closed a survey that was put out in partnership with Nationwide Children's Hospital to gather more resident level feedback and input on the impacts of COVID. So we'll be following up once that data is ready to be shared out to add even more context to the ramifications of COVID in the South Side, more from the resident perspective. A lot of the data that I'll share today is mostly pulled from high level sources like the ACS data points and things like that. Just to start us though with some context of the South Side even before COVID, because we know that in many ways there were challenges in the community. And I also like to point out the diversity that the South Side has. In the South Side, about 46% of residents are African American, and that's much more than the 22% or so of Franklin County residents. And so I think it's important that we not only highlight and celebrate this diversity, but because a lot of the data that we've compiled isn't available to be disaggregated by race, and yet we know COVID is being experienced by everyone, but not equally. And so I just wanted to call out as we talk through some of this data, because we know that factors like race, gender are creating a disproportionate impact in many ways on people's housing and economic security, especially in this time of COVID that we are calling more attention to these issues and disparities. And in the chart on the right, this is the median income for Southside households, and the blue line is the South Side as a whole, and the median income is about $32,000, which is about 40% less than the Franklin County median income at $52,000. But then I like to show these two charts together because the one on the left talks about the percent of people living under the 200% of the federal poverty line. And in the South Side, over 60% of residents are living below the poverty line, which is pretty alarming that over half of the community is struggling to make ends meet and to provide, in many ways, be able to provide their basic necessities. But the chart on the right shows that yes, unemployment in the South Side, even before COVID, was higher than the Franklin County rate, but over 80% of Southside residents are working. It's just oftentimes that residents are working in part-time or seasonal jobs, and often that means it's more difficult to make ends meet. So even before COVID, again, there were challenges in the community. And so I do like to show these because together because while there are higher rates of poverty in the South Side as compared to other parts of the city and as compared to Franklin County, majority of our neighbors are working. And I think sometimes it gets lost that when we think about people who are struggling, that people are trying to work hard for themselves and their families. It's just often sometimes not in a job or in a position earning that sustainable wage that they need. So then when we look at the actual experience of COVID, what we start to see immediately is that the South Side, and specifically 43207, is one of the hardest hit areas of Columbus for COVID cases. And so this data is pulled from the Columbus Health Department and is updated regularly. And so one of the things we're really concerned about is not only the current high cases of COVID, but also knowing that we're having challenges in maintaining and flattening the curve, that this is going to continue to be an issue for many of our residents. And I know in talking with a lot of residents, I hear often, like, I'm afraid of getting COVID, I'm afraid to go back to work, and these concerns that people have about the healthcare risk that still exists, obviously, with COVID. And then Southside residents, this is happening because they're more likely to have these risk factors where they're working in jobs that are deemed essential, so they have to actually go to work, or they're working in jobs that they can't do from home. So, you know, unable to actually work remotely or adhere to any stay-at-home orders if they're deemed essential or needing to go into work to actually to do that work. And then we know the South Side has a higher rate of underlying conditions like asthma and diabetes, challenges in accessing health insurance or healthcare. And then they're more likely to be living in household situations where there may be more than one kind of nuclear family living in the household, right? So it could be multiple generations living together to maintain that housing. And yet there's a senior in the home and a younger person who's still deemed an essential worker going to work. And we know that any exposure right now is increasing the risk of COVID. And then I just like to call out that a national poll found that African Americans and Latinos were nearly 3 times more likely to know someone who has suffered or died because of COVID as compared to white people. So again, we have this kind of higher disproportionate risk that people of color are facing with actual just COVID cases. And then we looked at how COVID is impacting people's employment situation and the workforce. So what we did was we pulled together all of the industries that Southside residents work in, and the top 3 are highlighted in yellow in the chart on the left. So many of our neighbors are working in the healthcare or social services, the food services and retail environments. And we know that those were very disrupted by COVID during the state mandated shutdowns. And so our research estimates that 1 in 3 Southside residents were employed in one of the 2 most disrupted industries. And again, that's really looking at people who are working in hospitality, retail, and food service. And then we know that many of the folks in those industries might have not qualified for unemployment insurance, or they had difficulties in actually obtaining that, obtaining unemployment. And then what we did was we tried to estimate what the actual unemployment rate in the South Side looked like. What they did was looked at the state numbers and considered how basically between March and April 2020, as compared to this time, that same time last year, what the change in unemployment was for the state, and then tried to apply that to Franklin County and then to the South Side. And for us, we have a 13 census tract range that we use for most of our data collection. And what we found was that there's probably an additional 2,500 people who experienced unemployment as a result of COVID in the South Side. And then the additional component we looked at was housing and the risk for eviction. And what the chart shows on the left is actually a positive trend if you look at it for face value, right? The number of eviction filings in 43206 and 07 zip codes has decreased this time, at this time compared to last year. But we know that that's not really the full story. So eviction filings were allowed all throughout COVID, but the eviction courts were not having hearings basically mid-March through the end of May. And courts reopened June 1st at the Greater Convention Center in order to accommodate the large volume of eviction filings. There were over 1,300 made during the spring kind of peak COVID time that we were in. And so we're really concerned about people being displaced because of COVID, because they've had a loss of income or loss of employment. And this is kind of compounded in then, again, people are wanting to work, but concerned again about their healthcare risk in going back to work, or their ability to have childcare for their kids, or bus services have changed during this time. So a lot of factors are coming together. And what I think it manifests is in this US Census Pulse survey where they gathered input from people, and 48% of low-income renters have little or no confidence in their ability to pay next month's rent. So obviously that's really concerning, and that's why we don't think that the chart on the left is accurate about the real risk for eviction in the South Side. And then because a lot of the partners in Southside Thrive Collaborative are social service providers and really in many ways the safety net for individuals at risk of these ramifications of COVID-19, I wanted to include some data that the Human Service Chamber of Franklin County and United Way of Central Ohio pulled. They surveyed their members and partners and found that all of their services, about 15% of providers had to suspend their programs, and 54% of them had to operate in a limited capacity because of COVID, and about 30% continued without any changes. But there's been about nearly $40 million in unrealized revenue by these organizations. So there's obviously a big concern for being able to respond to the increasing need that we expect to, and have already experienced in many ways because of COVID, and then being able to adequately resource the organizations and providers who help individuals meet those basic needs during this really critical time. And then they did just put out last week some new information where about 80% of the nonprofits in their network applied and received the payroll protection program. And as of mid-June, about half of them had already spent spent their loan money. And they included a projection for September that nearly all of the nonprofit organizations will have spent their PPP loan. And so they are working really hard to advocate for additional resources. And there's other partners like the City of Columbus who have put in additional funding through the CARES Act money to support these service providers. And so I know Ken just went through a lot of information, but I just wanted to provide just some context on what this looks like in the South Side as you all and your businesses are grappling with your own ramifications of COVID-19 and just thinking about the residents. I'm thankful to the different organizations noted here who provide support to Southside Thrive and helped produce this report. My contact is here, and I welcome anyone to continue the conversation. Like I said, I'll post a link to the report in our social media page. And then I also just want to kind of call out that two other things. One, I was able to get some masks, and so if anyone needs any for your businesses or your staff, I do have some and would be happy to drop them off to you if you need them. And then finally, we're working with CODA to host a forum on August 19th. It's a Wednesday at 4:30, trying to catch people who might be getting off work. And we're going to be working with CODA to provide some updates on the service lines. So a lot of the bus routes have changed. They're doing things differently to try and maintain safety and social distancing. And then they're also considering new initiatives like an employer-based model to provide more tailored transportation routes and providing more real-time kind of partnership with employers to make sure people don't face barriers with transportation and getting to work. And then they're also considering a cashless payment for riding the bus. And so they'll be providing some more information and wanting to hear input from different stakeholders in the South Side about what these new initiatives would mean for them. And so would invite you all to attend, and I'll drop a link in the chat as well if you all are interested in joining as well. So with that, if there's time for questions, I would love to field any.
And Sarah, just to let you know, I have a link to the flyer promoting the CODA and transit discussion on our parsonsarea.com website. So
Okay.
it's there as well. Any questions for Sarah? Sarah, thank you so much. We appreciate it. Any questions, anybody? Any points you want to talk about?
This is probably a good time, Bob, to mention the expansion of the city grants and loans for round 2. I mean, Sarah referred to the CARES Act and the city and county having funds for that.
Sure. The city and county and a number of other stakeholders have created this small business recovery funds for COVID and essentially there was initially a several week period in early July where people were eligible to apply for either a grant up to $10,000 for damages that your business may have had from COVID, and you could use that money really any way that seemed legitimate that you want, or there was also a matching fund for PPE, personal protective equipment, up to $5,000. And then there was something that they have called a pivot loan, which would be a low interest loan that for businesses that have to do, either had to do or taking advantage, if you will, of this terrible crisis and to make a major shift in their business, and you have some other expenses you need. So the good news about that, and we have a link to that information on our parsonsarea.com website. The good news about that is it's being extended for a second phase, and that will essentially, you can go on there, and the folks, I think, are getting ready to submit applications, but you can go onto that page and put in your basic contact information, and then someone will reach out to you when they're ready, and then work with you on an application together. So we've had a number of South Side companies who are in the process of getting support from this, and I really encourage people to take advantage of it if you can. It's not for nonprofits, and it's not for businesses that are purely alcohol. But if you have like a restaurant or a grocery, that sells alcohol, that's okay. And what we've been told, these launch pad, that requirement to low moderate income area is being lifted, and that was something that was impacting a number of our folks, because Parsons Avenue was a boundary for one of those low moderate income areas. So anyway, that's what we've been told, and if anybody is interested in following this, again, the first link on our website to go to the COVID Small Business Recovery Funds, and contact me, please, if you have any questions or want to get direct contact with some of the city folks. So to answer your question, Kathy?
Yes, thank you. Any questions for Sarah or Bob on those topics? And Sarah, I don't know if you have the ability to share those links on the actual.
I just put them in the chat, but I will email them to Bob as well in case he sends out an email follow-up. How about
That'd
That's
be good.
exactly
We can put it in the link to the YouTube video. That'd be perfect.
Great.
Thanks, Sarah. Other questions or comments or discussion with Sarah? And if not, that must be because she did such a comprehensive job. Sarah, you're wonderful. We really appreciate all that you're continue to do for and for PAMA, for the South Side, for everybody. So good stuff. Are there any other topics that folks want to bring up today? Everybody must be sleepy. Sure, there are no other topics?
Bob, I could introduce myself.
Go for it, Paul.
That would be lovely. Thanks, Paul.
Sure thing. So hi, everybody. My name is Paul. My partner and I, Virginia, started a brewery about a year ago. It's called Wild Seltzer Brewing. We specialize in brewing hard seltzer craft. The reason I'm on this call and the reason Bob invited me is because we are planning on leasing a space in Southside. It's like 85 to 87 East Innis Avenue, kind of across the street from 8 and Sands. So 8 and Sands is owned by Rich Russo, and he would also be our landlord for this lease. And so, anywho, the zoning is all funky, and I'm talking to Bob about it. He says he's, and so we'd have to get some. Well, we'd like to get some neighborhood input, but we'd also have to get some neighborhood input in order to deal with the zoning and kind of get that process started. So I reached out to Bob and Curtis about possibly working in that area. The Hungarian Village location, or Hungarian Village is just where we are. So, anywho, that's a little bit about us. So yeah, if you guys have any interest, any questions or any concerns, please let me know, and I think you'll just see more of me in the future.
And Paul, thank you so much for, after just talking to you a couple days ago, for being able to join us today. Curtis had to leave the call early, but you know, we'll be following out with you, and you know, and staying in touch, you know, as we go through everything. So good stuff.
Awesome, thank you.
And John's a new member too. I don't know if you wanted to introduce yourself, or a new existing member.
Well, I'm new. My name is Tia Johnson. I'm actually interested in bringing a business to the South Side, which is a company called Fresh Boom Bins. What we offer is a trash sanitation service. So right now, everyone knows that PPE gear is a new terminology for, I think, everybody in the public, but it's been used amongst certain industries and sectors. As we looked at COVID-19, I was already in the planning stages of bringing this business, but it really made me put the foot, I guess, my pedal to the gas. What we offer is a curbside trash sanitation. So right now there's this gray area, right, with the city of Columbus. Right now they'll pick up your trash and refuse recycling, but it is the residents' responsibilities to clean the bins and dumpsters. When I was connected with like Waste Management and other large companies that offer trash pickup, they don't technically have like a curbside cleaning. So it's this consistent gray area of who's going to clean our trash bins. I don't know if you probably experienced it, but I know I've deemed it trash trauma, right? We've all went to that trash can and it was covered with maggots, flies, or you were hit with that odor that you wish you didn't have to go to again. My skin crawls every time I think about it. What we initially tried to do was have the conversation with the city of Columbus and say, hey, we know that certain areas were impacted by COVID-19. We know that certain areas are not using trash liners. So all of that, gloves, masks, tissues are going right into the bins. You add diapers, food, and everything else that sits on the bins. You add the fact that it's just sitting there, no one's actually cleaning it. So we wanted to bring something new, something fresh to the South Side, and wanted to get businesses input, get residents input. How can we get the community buy-in to bring something like this in?
Thanks, Tia, for covering that. I was going to have you come next, so that worked out perfect.
Okay.
Yeah, welcome, Tia. This is good stuff.
Thank you. If you have any questions, I'm joining the group down, so I'm filling out my application.
Thank you. And any ways if, that you think that we might be able to help you too. I mean, we're here to try to figure out ways to connect businesses to the city services and other things, you know, that you may need. So anything we can do.
Thank you so much. I appreciate it.
Other folks, anybody else who just is burning to say hey?
Good morning. This is Angela Mingo with Nationwide Children's Hospital. I wanted to say thank you for the invitation this morning to be a part of today's meeting. It was great to hear from both of our presenters. Just received a wealth of information, and that's welcomed for us here in community relations, as we're the touch point for so many different organizations that are affiliated with the hospital. We have been actively working through our neighborhood initiative, Healthy Neighborhoods, Healthy Families, to help support families on the South Side that we have proximity to, whether it be our patient population or our housing tenants. For those who may not be familiar with some of the work of Healthy Neighborhoods, Healthy Families, Nationwide Children's Hospital has a portfolio of affordable housing that is rental in the community. We did have a home ownership product years ago, but we realized that there is increasingly a shortage of safe, clean, and decent affordable rental housing. And seeing Sarah's stats, this morning is just a reminder of why our collective work is so important to support residents, whether it be through commercial supports. And Tia, I really enjoyed hearing about your business. On a personal level, my husband is a czar when it comes to trash, and I was taking notes because he's always talking about the plan to avoid the trash trauma. I love that term. It's the trash trauma is real.
It's real.
It really is. But we've been trying to work with our housing tenants just to make sure that we are supporting them during this time of COVID. And it was a pretty sobering data point, Sarah, that you shared when you showed the eviction chart. And we know that, those numbers for March through May were pretty artificial because of the additional federal support and unemployment support that families were receiving. And so we are all here kind of watching and waiting to see what does this mean for families as we're entering, now the month of August. What levels of support will they need, and how can we continue to provide connections with different social service providers, and also have understanding when we're dealing with our tenants who really just need a little more flexibility when it comes to rent and some other just basic needs. So happy to be on Zoom today. Great to see everyone, and thank you again for the invitation.
Always happy to have you. So the hospital is such a great partner with us, and certainly your right-hand person, Carla Fontaine, is a jewel for us. So we appreciate it.
Thank you so much, Bob.
Other folks, anybody want to say hey? Raise any topics, anything?
If not, we'll have this again in September. I think we're going to be virtual for a while yet. So, feel free to reach out to parsonsarea@gmail.com. That'll get to Bob and I, and also access the website as needed. So thanks again.
Yep. So, yeah, September 2nd is the next one of these meetings. We do start at 9 as opposed to when we're at the library, we would meet at 9:15. That's where you got the 9:15, Sarah. But there's no need to have the 15 delay, here when we're online. So we'll be having the Chamber Energy Program presentation there. That should be a good one. And also, please don't forget the event. And I have the flyer posted on our website, the CODA and Transit Services that Sarah talked about on August 19th at 4:30. So if there's nothing else, we pledge to try to keep these to an hour. We're pretty close here. I think Kathy started promptly at 9:05, so we're at 10:03. So thank you, everybody. We appreciate it. Have a great day.
Thank you.
Bye-bye.